Hello and welcome to It's All About Your Health. Today we're at Memorial Hospital, Pembroke. We're going to be speaking with a plastic surgeon whose name is Dr. Blaine Shatkin, and he's going to tell us all about the wound care center at this hospital. So let's go meet Dr. Shatkin. This is Dr. Blaine Shatkin, who is the medical director of the Wound Care Center at Memorial Pembroke. And it's a pleasure to meet you, Dr. Shatkin.
Very nice meeting you, too.
And so tell me what the Wound Care Center is all about. What do you do? What kind of patients come to you?
Well, our goal is to treat patients and see them and put them into a diagnosis-driven protocol, meaning, you know, we make their diagnosis like a diabetic foot ulcer, and then we follow very strict protocols for healing. We've had very nice success. We've been open since 1997. We have healing rates in the last 10 years of greater than 95%.
Wow.
And we generally, we just follow standard of care protocols, but when it comes to problem wounds, which a lot of patients have,
Especially
diabetics, people who smoke, who have arterial disease, then we look at advanced wound modalities. Now, advanced wound modalities would include hyperbaric oxygen therapy.
Of which this is the chamber.
This is one of our chambers here. We follow strict Medicare guidelines in terms of the patients we place in our chambers. So the most common diabetic wounds of the lower extremity and arterial disease, where we're trying to save the limbs. So limb salvage is really our goal, because once a patient loses even a toe, they have a 50% mortality in 5 years. And so our goal is to get them to heal before they get that bad.
Wow. And a patient lies in this chamber so that the entire body
That's correct.
gets treated.
True hyperbaric oxygen therapy is exactly that. You go into the whole body goes into the chamber. It's not topical oxygen. You're breathing it in. It is basically you're absorbing so much more oxygen because of the pressure, and so you absorb more oxygen in the bloodstream. It gets out to the wounds, and then you heal.
And how long does a patient stay in the chamber?
They're 90-minute treatments, but the whole entire treatment's about 2 hours. So it's a Monday through Friday type protocol, where we'll treat them for the 2 hours daily, and usually each protocol is about 30 to 40 treatments.
So it's a commitment.
It's a commitment, and we do get the insurances to authorize this type of, it's very expensive without the insurance authorizing it, but it is a modality that works.
Do pay for it.
It works, and there's certain criteria that we make sure that the patient meets before just jumping into hyperbaric oxygen. And once they meet that criteria, usually we don't have a problem getting it authorized.
It's a wonderful program. It's a wonderful thing that you guys are doing, because too many people that I know have lost limbs, and sometimes I think maybe they didn't have to.
Well, chronic wounds, it's like people don't want to always talk about chronic wounds. It's not like a pretty subject like aesthetic plastic surgery is. So,
Right.
Wound patients in the community tend to bounce around to Whirlpool or physical therapy. They're not always getting the appropriate treatment. So we really want them to know that we're here in our community for them.
Thank you, Dr. Blaine Shatkin, for all you do for this community and people who really need you.
Well, thank you, Elaine.
It's got to
a
be
pleasure.
very rewarding to find that your success rate, you get a patient who looks really sick, and they walk out after a month.
Well, a lot of times they're told, we now have to amputate your leg. And then they get to us and we save the leg.
You're kidding.
So we've had that happen numerous times. So we want the doctors in the community to notify us early so that we can help their patients.
For OCTV, I'm Elaine Kugelman, and thank you for joining us today at the Memorial Hospital Pembroke Wound Care Center.